today I'm going to show you on how to do Perilite exposure, which is an application of dry heat in the perineal area in order to provide comfort, increase blood circulation, as well as hasten the wound healing by means of Perilite lamp that is 18 to 24 inches away from the body to be exposed. The first step is to explain the procedure to the patient. Explanation will minimize anxiety and reduce discomfort of the patient towards the procedure. This is also a good way on how to establish rapport. Hi, Mrs. Santos, how are you? Hi, my name is Jeffrey and I will be your nurse for today. I will be doing an application of Perilite exposure. This will give you comfort and increase your blood circulation, as well as it will hasten the healing of the wound on your perineal area. Is that okay with you? Upon getting the approval, you can now proceed to the next step, which is washing your hands. It is very important that we wash our hands because it will reduce the risk of contamination of the infection to oneself. After washing your hands, you can now start gathering your materials. So I have here my Perilite lamp, my antiseptic solution, and other materials that I will be needing. Because it is very important that we organize our materials, because it will help us to manage our time efficiently and effectively. And we don't want to go back and forth to the storage room just to get our materials, which is really time consuming. Next step is to assist the patient into a dorsal recumbent position with knees flexed and legs separated. This position helps facilitate to the optimum treatment result. Next is place the Perilite lamp between the legs 18 to 24 inches away from the area being treated. This is done to avoid burning the tender skin. Just to give you a quick information, the skin in the perineum is so sensitive, that's why we don't want to inflict any injury to the area. Next is cover top bedding. To provide patients privacy. And then leave the lamp in place for 20 minutes. Mrs. Santos, the procedure will take for about 20 minutes, but don't worry because I will come back every 5 minutes just to check on you, alright? After 5 minutes, check for rashes, discomfort, and burning reaction. These signs indicate that the lamp is too hot. Might as well ask the patient about the temperature. Hi, Mrs. Santos, how are you? Is the temperature too hot? If the patient said yes, then you have to adjust the lamp. Then cover the patient again to ensure patient's privacy. Just a quick safety precautionary measures that we have to take into consideration. Even though the patient is in lying position, there's a tendency that she will get tired and accidentally close her legs, which could cause or inflict injury to other area like her legs, thigh, and lower extremities. That's why we have to keep that in mind. And that's why we have to get back to the patient every 5 minutes just to avoid that kind of incident. After 20 minutes, remove the Perilite lamp and then check for any untoward reaction. Concentrated heat like this lamp can cause burning. That's why we shouldn't have to place or leave the lamp for more than 20 minutes. As I've checked the perineal area, I don't see any kind of untoward reaction, which means 20 minutes is enough and not too long. Next is assist the patient in comfortable position. After that, you can now return the Perilite lamp to the storage area, but don't forget to clean the washable area with an antiseptic solution. And lastly, don't forget to document the procedure as well as the results into the nursing chart. And that concludes my demonstration of the Perilite exposure.